everyone, welcome to another episode of Peak Performance. Really excited about today's episode down here at Unity Gym with Rad, and we're going to talk about shoulder active impingement. It's one of the most common issues that we face in everyday life. A lot of our corporates suffer it, and a lot of guys that come to the gym regularly suffer too. Most often it's because of poor shoulderal synergy, movement synergy. Now that is your ability to move your shoulder through its full range of motion and everything staying where it's meant to stay, okay? It's kind of weirding me out, you moving around like that. I don't know where to look. So what we're going to do today is go through the 7 steps to overcoming shoulder active impingement, and we'll go through a fair bit of detail. You look down here. First of all, we're going to start off, I've got all my mobility stuff here. We're going to start off, back to me. I guess the first thing we need to do is identify what the cause is, okay? What the cause is, and then eliminate the causes. And in most cases, I'll tell you it's sitting in front of your computer with your hands in a sublux position, same as driving your car, shoulders internally rotated, humerus internally rotated. The shoulder capsule starts to adapt to that position. So we have to try and eliminate those positions. So if you're working, get up, move around, stretch. You can do some shoulder scapular retraction exercises, things like that. You can lean into a doorway. I'll quickly run over here. This is a really good one. Just leaning straight into your office doorway like that's going to release and open you up a little bit. If you can do that a few times, fantastic. And the other one is common, lifting too heavy in the gym. Bench press, chin-ups, overhead press. If you've got poor synergistic movement in the shoulder, that is that the rotator cuff isn't locating your humerus properly, as you press, you're going to impinge. And that frequent impingement, the supraspinatus coming underneath your collarbone, it just ends up getting rubbed and bashed and squashed and inflamed, and it starts to hurt. When the supraspinatus is inflamed, there's a very complex brachioradial nerve stem that comes out of your cervical spine. It fans out like tree roots through your shoulders, and then the main nerves run down through your arm. Any little impingement on any of those nerve stems creates severe pain and discomfort, and that can radiate right throughout the shoulder. It's very hard to pinpoint. So what I'm going to show you today, very importantly, a lot of the exercises that are really beneficial for this are also exercises that aggravate the issue. So you have to use a really, really clever and I guess knowledgeable exercise selection path, otherwise you can cause inflammation and aggravation again. So let's go through. First of all, mobbing is super important, and the first one we get people to do is a very basic long lay on a long foam roller, and we just get people to open up like this. If you're really restricted through the shoulder girdle, this is going to be enough of a stretch. As we increase the mobility and you feel absolutely comfortable doing so, you can start to bring your hands up above your head, and once that feels nice and comfortable, you can start to bring your arms downward a little bit and try and achieve a 90-degree bend in the elbows, okay? From here, we move to a chest drape, and that is with a half D roller, straight across the back, and we're just going to open up like that and achieve that same position of 90 degrees. Nice big deep breaths, letting all of the rib cage open up. From here, we move to these amazing tools, and this is more specific mobbing. We've got a soft back ball and a hard back ball. I recommend using the soft one first. These can be ordered online, or you can come into Unity and we'll organise a pair for you. And we place this on the 12th rib. Just jump in and have a look at the back here. We place that on the 12th rib. We gently lay backwards on there, and then we're just going to open up again using a few different positions. Nice big deep breath, reposition to the next rib. Nice big deep breath, and we can also drape across and really spend about 2 to 4 minutes, maximum 4 minutes. We don't want to push a rib out of place doing this. So just start off nice and gentle. When you first start on these back balls, it is quite intense. So go soft and easy on yourself. You can even roll up a towel underneath that to make it a bit softer. From there, we're going to go to specific. I've got a shorter foam roller for this one. It's just easier, especially if you're in your lounge room. We're going to go to more specific myofascial release. So now I'm actually running down the latissimus dorsi into the infraspinatus and teres minor in the back of the shoulder and the rear delts, and we're just very gently mobbing that area to release the tension, okay? We're also pushing all of the blood flow and the byproducts from exercise out through the bloodstream again and through the lymphatic system. Nice and easy, and we can even roll into the attachment of the triceps muscle, the triceps brachii, and down into the lat and the serratus anterior a little bit to release all of that tension, okay? And then obviously we would roll over and do the other side. All right, so we've step one, identified the cause, and we've started to eliminate it. Step two, we've worked on increasing flexibility in mobbing and really specific core improvement exercises. Now we're going to do very specific chest stretching exercises because most of the problem is occurring from a shortness of the pec major and minor. So the two pec stretches we do, other than the one I demonstrated on the door there, we use a prone chest stretch in Unity Gym, which is palm down to 45 degrees, and then we gently press this shoulder downward into the floor and rotate away. Nice big deep breaths, because the chest is on the outside of this, the rib cage. So each big breath is going to expand the rib cage and stretch from the inside out. That's the pec major stretch. The pec minor stretch, we're going to hit it from a bent arm, exactly the same thing, pressing this shoulder downward to the floor and gently rotating away. I'm very flexible here, and you can see I don't need a lot of rotation. It doesn't take a lot to stretch. The last one is tipping the can out, thumb to the floor, and now we're hitting the biceps brachii, which also the long head attaches up into the shoulder. So now we're rotating away. Again, this shoulder to the floor, nice and easy. Nice big deep breath. Okay, and of course, we would repeat on the other side. Now we're going to move into specific exercises to work the rotator cuff. So we've released everything. Very crucial, I should have said this at the start, you must follow this sequence of events. If you don't find the cause of the problem and eliminate it and start to overcome what's causing it, step one, doing all of this is completely useless, okay? If you miss step two, the mobbing, and jump straight to the stretching, it's probably going to feel really uncomfortable. And if you skip any of that flexibility work and go straight to what I'm about to demonstrate now, which is isolated rotator cuff work, you won't be able to do the movement. You won't have the mobility, and you'll probably cause, remember, more aggravation and more pain, okay? So the first isolated rotator cuff exercise, you'll see I've got it on 5 pounds, the lightest weight possible in your gym or facility. We're going to start with the hand on the belly button.
Not everyone's as weak as you though, mate.
Yeah, well, I've got pretty strong shoulders and I don't lift very much weight here, okay? Crucial that we've got the forearm braced and locked. We don't want to flex your wrist at all. And here we want minimal movement in the shoulder. So everything is nice and still. We can go out for a 1 second count and then 3, 2, 1, back to the belly button. Out for a 1 second count, 3, 2, 1, back to the belly button. I'm actually holding my finger on here so I can feel if my deltoids are firing up a lot, to make sure that it's my rotator cuff creating the external rotation movement. Pay special attention to the angle of my elbow. It should not change throughout the range of motion. Nice and slow back down. About 6 to 8 repetitions is ideal for the rotator cuff muscle, okay? From that point, we can transition to what's called a seated dumbbell rotation. I'll grab a bench and we're going to, I'll demonstrate with my right shoulder here. We're going to establish a very neutral spine. We're going to rest the elbow right on the meaty part of your VMO, looking at a 45-degree angle so the neck's in alignment. 3, 2, 1, full stretch, externally rotate. 3, 2, 1, once again, no movement in the wrist, no movement in the shoulder. 3, 2, 1, rotate. 3, 2, 1, rotate. Shoulders nice and still again, okay? Again, 6 to 8 repetitions. You can go up to 10 reps if you want, but that'll mean you'll start on a lighter weight. Okay, so the final stability exercise for the rotator cuff, and this is a later progression, is an inverted kettlebell dumbbell press. I like to use something to brace on, so we move to an incline bench. Holding on here nice and steady, we've got the kettlebell inverted, so that's creating instability, okay? And now we're going to do a vertical press, and we're balancing the kettlebell. And we want to do about 8 to 10 repetitions here. Nice and controlled on the way down. This is a 6 kilo kettlebell. You will start on the lightest kettlebell you can get your hands on. That should be 4 to 6 kilograms, okay? Press, nice and slow down. Press, nice and slow down. Now alternatively, you can get yourself a ThoroBand and attach it to a wall if you don't have access to a cable, or you can get PhysioBand from any sort of sports shop. We're going to run overtime. We're trying to keep this video to 5 minutes, but we're going to probably run for about 10 minutes. Hopefully you're enjoying the content because we've got lots to show you. All right, the next step from that is that we're going to start increasing the strength of our scapular retraction, because now we've developed stability, we've developed mobility, we now have to increase that scapular retraction. But the most important thing is that we create functional, active movement. And we're going to do that with a very simple body weight stretch. You can do this on a bar, but we prefer to use the rings at Unity Gym. We've got them set up here, so literally all we're going to do is relax and just hang using our body weight. Now you see I've got my feet on the floor, so I can choose how much weight goes through my shoulders, but essentially I'm just trying to completely relax, and I'm getting a really effective stretch right through the chest, lats, and the shoulder, rotator cuff. So nice and gentle, and we can gently rock back and forward, which is going to distract the joint. Nice big deep breaths. We're always breathing, focusing on breathing as we're stretching. You do that for about 15 to 30 seconds, and you can do it 4 times every time. I'll throw this out there. You should do some form of hanging. If you're in a desk job, or if you enjoy your shoulders and want to use them for your entire life, you should do some form of hanging every day. Every day. It's also going to develop really healthy grip strength as well. Find something you can hang off, relax and let the shoulders go. Okay, now we're going to work, because we've got all that great range of motion, we're going to work on scapular retraction. The first thing, I've got my dumbbells, 3s and 5s. I've got my band. So the first thing we can do really easily, and you don't need a gym for this, you can just get a ThoroBand, is a band pull apart. And what we're trying to do here is squeeze the scapula back and create some tension. Squeeze the scapula back and create some tension. Nice and slow and controlled. Okay, you can do 8 to 10 repetitions on there. Once you've mastered that, we're going to transition to some loaded exercises. The first one we're going to do is what's called a parallel raise. We've got the bench set up to 45 degrees. We're going to assume the centerfold position, which is like this. And then we're going to allow the shoulder to drop down. The aim of this is to keep your elbow nice and straight, your wrist taut, and we're going to raise straight up in the air, 3,000, 2,000, 1,000 to the front. You'll notice that just doing this movement properly, full range of motion, is creating that shoulder movement. I'm retracting my scapula, and then as I come down, the scapula is protracting into the forward position. So I'm getting lots of movement, lots of healthy movement through that shoulder. Retract, up, nice and slow down, and forward. Keep the weight light. That's 5 kilos. I'm a bit of a unit. That's heavy enough for me right now. I'll work up to, once I'm warm, 7 or 8 kilos, and that's heaps. So start at maybe 2 or 3 kilos if you've never done this before, okay? The next one is a more advanced variation of a scapular retraction, which is called a dumbbell trap 3 raise. We start in an upright position, so our body wants to be at about 45 degrees. Looking straight ahead, we retract the scapula, lock the elbow straight, raise so as to get the bicep in line with your ear. Now you'll notice when you try this, if you try this before you're ready for it, you will not achieve optimal range of motion. You have to have that shoulder mobility first. So steps 1, 2, 3, and 4 are critical before you get to this point, okay? So retract, raise, bicep in line with ear, nice and slow down for 3 seconds, keeping the shoulder retracted, and then the last step is to relax the shoulder. So we'll break it into 4 movements. 1, 2, 3, 4, okay? 8 reps, 8 to 10 reps, repeat on the other side. After this one, we're going to transition to our more advanced shoulder movement, and this requires quite a lot of flexibility, and it must be done properly. But this is the last active exercise that we're going to do, where we're creating active mobility, not passive or static mobility like what we were doing on the floor. This is active mobility. We're taking the shoulder joint through its extreme range of motion whilst in movement, and we're going to use a dowel rod for that. So there's 2 positions that we do our shoulder dislocation. First one is standing straight, and it is critical that as we take the dowel rod over the head, we elevate the shoulders nice and smooth. We're looking for a smooth movement, and then we relax around the back. As we come back up, we elevate the shoulders again, so shrugging the shoulders down, and we relax the scapula. This should be a controlled movement the entire way through, and if you feel as though there's sticking points, you either need to widen your grip or you need to go back to step 1 and 2, or step 2 and 3. Work on mobility. So from the side, nice wide grip to start with. We raise into a front raise. Once we hit the top of that front raise, we start to move into shoulder shrug or elevation. Nice smooth movement, and we relax the shoulders. Back again, once we hit that raise position, we go into a shrug across to the front. Once we can do it standing, we transition to doing it bent forward. So from here, we raise, shrug, and back down. Up, shrug, and back to the front. Critical that we use that as the second last step, and once we can do that, it's time to transition to power movements. Multi-joint, compound, integrated movements, standing and lying down, and that's what we use the bench press, overhead press, chin-ups, and bent over row for, and that's when the fun begins, which is step 7. But you cannot, and I'll repeat this, you cannot transition back to doing heavy benching, heavy shoulder pressing, heavy chin-ups, and heavy bent over row unless you have this one down pat, unless you've got that active functional mobility going. You will repeat your injury. You will re-aggravate your injury. So we'll very quickly go through the movements of a bench press, bent over row, shoulder press, and make sure, and chin up, and make sure that you guys know what we're doing. So bent over row, scapula retract, squeezing to the tummy, release, release the shoulder. Once you get that down pat, it should look like a nice smooth movement. If you're lifting and you cannot retract the scapula, guess what? The weight is too fucking heavy. Lower the weight and do it properly. Focus on quality of movement, not just quantity of weight, okay? Same in the chin up. If we're doing a chin up, if you cannot set the scapula before you do the chin up, it's too heavy. You need to use band assisted. You need to just focus on a lat pull down first. Lift for quality of movement, not for quantity of reps or maximum weight always, okay? If you can get the movement right, by all means, load the weight up and keep loading the weight up. Nothing more fulfilling than lifting more and more weight. But if you don't do it properly first, you'll stuff yourself up again. Same in the bench press, same in the shoulder press. Make sure the scapula is set as we're pressing, so we'll quickly demonstrate that. All right. So, scapula set, press, press. Everything is tight with my scapula. You see the difference? Pressing here, shoulder unstable. Pressing here, shoulder stable, because I've achieved that strength in my scapula. It's exactly the same with the overhead press When we get here, we set the scapula, press, shoulders stable, okay? Quality of movement is crucial when we're lifting heavy weight. Enjoy, I hope you guys enjoyed that video. Like, share it with your mates who are experiencing shoulder pain, and let's go lift some heavy shit, let's go.